Hi everyone, I'm Spencer Solomon, and this is my Lassa Fever PSA. Type of pathogen. Lassa fever is caused by Lassa virus, a single-stranded RNA virus. Unlike some other types of pathogens, they are a virus, so they are non-living and need a host to survive. Here are two pictures of Lassa virus at the bottom. Mode of transmission. It is transmitted from rodents to humans by two ways. The first way is by indirect or direct contact with rodent droppings and urine from rodents that are carrying the virus. The second way is through the consumption of rodents who are carrying the virus. Eating rodents is somewhat common in certain parts of West Africa, which makes the virus more common there. It is transmitted from person to person through bodily fluids. Morbidity and mortality rates. Mortality rates. 15 to 20% of people who are hospitalized with Lassa fever die. Roughly 1 to 2% of people who suffer from it overall die, though. In pregnant women who contract Lassa fever, 95% of their fetuses die. Roughly 5,000 people die each year from Lassa fever. Morbidity rate. Roughly 100,000 to 300,000 people suffer from Lassa fever each year. In some parts of West Africa, 10 to 16% of people who are admitted to hospitals have it. Origin and infected regions. Lassa fever's first case was reported in 1969. It was named after the town in Nigeria that it was first discovered in, Lassa. Most cases come from the West Africa region, i.e. Sierra Leone, Liberia, Guinea, and Nigeria. Signs and symptoms. The incubation period is 6 to 21 days. Early on or mild symptoms tend to be fever and feeling of weakness. If it progresses later on, the symptoms become sore throat, nausea, suffering from various pains, vomiting, and heavy coughing. Some people never even reach these symptoms, though. Very severe cases have shown facial swelling, liquid in the lungs, complications with hearing, low blood pressure, seizures, and death. Approximately 80% of people who get Lassa virus are asymptomatic or experience very mild symptoms. Doctors look for signs like fever, weakness, and discomfort early on to diagnose Lassa fever. Diagnosis and prognosis. Doctors usually diagnose it using various laboratory tests, including ELISA and RT-PCR tests. Without tests, Lassa fever is hard to diagnose because many other illnesses in the same regions have similar symptoms. The prognosis for Lassa fever is often good as long as people follow proper care routines. Most patients don't get hospitalized, and the average recovery time is 12 to 15 days. Treatment and care. The CDC says that the drug ribavirin has been effective in fighting Lassa fever when it is used early on in the infection. People suffering from Lassa fever should attempt to stay hydrated and maintain a proper electrolyte balance. It is also advised that someone who's infected get as much rest as possible. They are currently working on a Lassa fever vaccine. Prevention. Basic prevention will include staying away from rodents since they might be carrying the virus. You would want to keep your home clean and keep food in secured containers so that rodents aren't attracted to your home. If you're forced to care for or be near someone with Lassa fever, it is best to wear protective clothing including gloves, goggles, masks, and other protective clothing items. Also attempt to keep as much distance as possible between you and the person. Here are the list of sources I used for my research. Thank you all for watching.